Hey AT Core Nerds. So today we're going to go over the 5 clinical tests for Laslett's clinical prediction rule for SI joint pain. Yeah! Alright, if my wife would hop on the treatment table. So you're going to lay supine. Go ahead and legs flat. So this first one is the compression test. So what you'll do, hands over ASIS, and you're going to just push down posteriorly. Just like that.
Why is this called compression test?
Because as you push down where the PSIS would sit, it creates compression with the SI joint. A positive test would be a reproduction of symptoms or pain. The next one is going to be the thigh thrust test. So for this one, as it's described, we're going to be testing the right leg. Bring this leg up, have the patient lift up just a little bit. Left hand goes over the sacrum, just as a stability, and then you're just going to push the thigh down. So you create a vertical force through the femur. Positive is pain or reproduction of symptoms. Now for some people that could be an awkward angle to come across, so if you're a little nervous about it, I was thinking maybe you could throw a nice little towel roll in there. It's still stabilizing the sacrum, and then you just do the same thing. Put a nice little thrust on the femur. Next one's going to be Gaenslen's. So for this one, you have one leg down, one leg going into flexion. You just create torsion of the SI joint. A positive sign is pain or reproduction of symptoms. Go ahead and lay on your side, facing that way. This next one is the distraction test. So kind of like the compression test, you're going to have your hand over ASIS. You're just going to push down. Nice little vertical force. So a positive sign of here is if it relieves their pain or any associated symptoms.
Because?
I was just about to ask you. So in this case, because you're pushing down, the joint actually decompresses. Go ahead and lay on your stomach. And the last one is the sacral thrust. Hand right over the apex of the sacrum, and then you just push straight down. Same thing as the rest of them. Positive is pain or reproduction of symptoms. If you have 3 out of 5 of those tests positive, you have a high likelihood of pain coming from the actual SI joint. The article that talked about these, it said the specificity was rated at 78%, sensitivity was 91%. But if you use the principle of centralization, so going off of McKenzie's exercises of lumbar extension or lumbar flexion, and the pain actually focuses more over the lumbar spine, the specificity actually went up to 87% with sensitivity of 91%.
So what does that mean?
So what that means is this clinical prediction rule, you can have high confidence if there's no centralization that you can rule in or rule out SI joint pain.